You're watching HelloNation.
Hello, welcome to the HelloNation podcast, your voices of good news. I'm Prescott Rossi. Here in the studio, we have Tim, we have Brittany, and joining us today on our Hello Healthcare series is nationally recognized founder and CEO of FreeRx, Carl Stecker. Carl, welcome to the show.
Thank you, Prescott. Glad to be here and good to see you.
And I love that backdrop. Oh my goodness, am I jealous. But being the voices of good news, we like to start by asking our guests to share their own. So Carl, please tell us a little bit about yourself and any good news that you've experienced lately.
The good news is that we just got through Easter and Christ is risen and we're saved.
The topic that we have today about healthcare, prescription drugs, is something that touches all Americans, regardless of whether you're on the beach down in West Palm or you're up here in upstate New York. And so I've been really looking forward to this back and forth, this podcast episode. And so the first question I have for you, Carl, is just exactly when it comes to drug prices. I mean, let's start at the basics. How are drug prices determined in the U.S. and why are they so expensive?
That's a question we get a lot. And in the United States, there's really not a formalized purchasing criteria. As I hear these conversations, a lot of it is, people like to point the finger at Big Pharma, and Big Pharma is not the problem. Big Pharma does all the research. They come up with these great medications for us. They're doing tons of R&D. Their spend on R&D is incredible. If you take your local pharmacy, your CVS or your Walgreens on your corner that you go to, down the street from your house, they probably got 6 pharmacists, for their morning shift, their afternoon shift, just to run that one small store. And you think about the cost of that, the brick and mortar, the labor, and then you've got all your people maintaining the pharmacy, keeping up with it, checking people out, stocking the shelves. Now, all of a sudden, you look at that one store and that amount of pharmacists, and then you take thousands and thousands of stores. And so now you're paying for all that overhead or that distribution model. And so, I think the beauty for us was when we came into this, we didn't really know what it needed and what it didn't need. So we just tore out everything. So now my distribution has gone to sending the prescriptions directly to your home. And, we're not maintaining all that brick and mortar. So now all that overhead savings I put back into the pocket of the users.
Well, I think that's a perfect piggyback into the next question then. So how do prescription savings programs let people sidestep those inflated prices entirely?
They do. I mean, there's your discount programs out there. And we also have a discount platform. The thing that I think we did differently is we said, let's make this, and keep in mind, the company started out of my own situation. It just made me aware. I was going in for my second open heart, and they give you a whole slew of prescriptions. And so I go into the pharmacy, my little local pharmacy right up the street, and I get hit with a $407 deductible. And so I came off the hip for that, Prescott, and because it wasn't an elective surgery, right? I really didn't have an option. And so I came off the hip, paid my bill. I didn't even make it to the door. And I started thinking, this could be somebody's daycare allowance, right? This could be their car payment. This could be their rent. I mean, all of this stuff is running through my mind. I said, this system is so broken. We wanted to create an environment that people could access all the medication they need and get it timely and get it affordably without surprises. So we're just constantly looking at how do we make things more affordable and how do we cut the middleman out? And so, yeah, it's not really about Big Pharma.
And Carl, that story of, do I get my medication, or do I pay my electric bill, or do I get food for the week, or whatever? I mean, that's a story you hear all over the United States. That puts wind in the sails for so many Americans in so many different circumstances. Let's talk a little bit about the monopoly effect when it comes to prescription drugs. I mean, what role do patents play in drug pricing? You talked about big pharma, but the patent system as well. What role does that factor in?
It is huge. That's why you get, and the pharmaceutical companies know it. They've got to make their strike. You get a patent, you've got a patent for 7 years. They got to make their strike in that 7 years, because then you're going to have people creating generics. They're using your ingredients. They're the same, the same effect, the same ingredients. A generic is a direct image of the brand. The only thing you get from a brand that you don't get from a generic is higher prices. While they have that patent, they can pretty much charge whatever they want. So that's why your brand pricing you see is typically a lot higher. It does not have anything to do with the quality of the medication at all.
And so coming off of that and the patent process, how do prescription savings programs, generic medications, help consumers bypass brand name patent pricing and still get the treatments they need?
So generics are the key. And, just about every medication at some point is going to become generic, right? Once that patent expires. So you may have to wait a little bit longer if you can't afford it. We're going to try and connect the member to those price points. So it's not just about us, it's about the member.
Why do you think there is a lack of government price regulation here in the U.S. that could maybe account for why prices are so high?
I think that America believes that the free market prevails, and we don't try to control companies and control their pricing, and that's just the stance that we take. And I don't think that's a wrong decision. I really don't. But I think that also it allows two things to happen, right? It allows the company that's got the product, that's the innovator, if you will. They've come up with the product. They've come up with curing somebody's ailment. And they should get credit for it, and they should make money on it. Ultimately, competition will regulate the industry the way it needs to be regulated. I don't think that getting government involved and trying to, you had Joe Biden try to get prescription prices down. Now you've got Trump trying to get prescriptions down. Doesn't matter what side of the fence you are. It's all just a matter of finding the right place to get the stuff at a reasonable and fair price,
And you mentioned that competition there. Are there any regulations that exist here in the U.S. to control drug prices? What steps have the federal government taken to help limit and control drug prices?
I don't think a lot. Just to be frank, not really a lot.
Talk is cheap.
It is. And we do a lot of Benefits in a Card does a huge amount of work in the staffing industry. And staffing industry has about a 400% turnover. So people aren't there long. And in the staffing industry, our pricing is half of what it is in the public market. But the reason for that is that people aren't around long enough. But we made a corporate decision, and that was because we're supplying the staffing industry, we're going to take that amount that we save by people not being on the plan as long, and we're going to give it back to the people. But, it's all about when a company sees that they're making more in one sector than another, that company has the opportunity to use that as an opportunity to give that money back, or they can keep it.
Tim, go right ahead.
Well, yeah, no. I mean, so we talked a little bit. You mentioned there's got to be more. There's got to be a way to give back. I mean, I've been really just listening to this, and yeah, you're right. That could be more than a car payment. That could be more than the child care. Pharmaceutical drugs are expensive. Yes. It's very expensive, and and more than anything, it's scary, right? I think of it as I'm a parent, and my child needs something that's life or death. They need it. So was it more that came to you on the why you had to do it?
Oh yeah, I mean that was all of it. I mean it was all of it was about helping people. All of it was that emotion that I felt. So here I am with the best insurance that I can procure. right? So I go out and I'm shopping these plans. I get the best plan that money can buy, and I get hit with a $407 deductible. And I mean, that's going to ruin your darn week. And I want people to be, one of the things that's happened is that with these drug prices going up and inflation and everything that's gone on, these people are starting to skip doses, and they're starting to, they're trying to get by with half their blood pressure meds. And that's not healthy. And it's not healthy for people. And it's not healthy to skip your meds. And that's what's happening. And a lot of people that, heck, when I lived in Chicago and I was a trader in my early days, I didn't have a car. You don't. So if you got to go get a prescription, you might have to go outside. If you're in Chicago, you might have to drive almost to O'Hare to get a prescription filled. Who knows? I mean, that place has really gone down.
Yeah. And Carl, you mentioned the inner city, the lack of pharmacies. I had a Rite Aid right around the corner from me. That was where I went to get my prescription drugs. They're gone. So, yeah. I mean, I have a car. I can get to Walgreens, but not everybody is fortunate enough to have that kind of circumstance. Tell me, how does Big Pharma influence healthcare policy, both at the local level and also nationwide?
Big Pharma is probably one of the largest lobbying groups out there outside of, firearms and alcohol, tobacco. Big Pharma they didn't used to be able to advertise on television. Now, if you watch the news and you're almost all of your commercials are, my wife said she had a problem the other day and I'm like, well, get some Skyrizi, just because I've seen the commercial 1,000 times.
Yeah.
Right?
Get
some Skyrizi on it.
It's Big Pharma and gambling.
And now you got people calling their doctor, I need some Skyrizi. But that's what they want. That's the effect they're going for, and it works.
So how do prescription savings programs? We've talked quite a bit about this. Cut out the middleman. The PBMs, insurers, pharmacy markups by negotiating directly, so members get real medications without the inflated costs driven by lobbying and middlemen.
To give you an idea, typically your medications are going to change hands 7 to 11 times before they get to you. Okay. So that gives each one of those transactions is a slice out of the pie. Each one of those transactions is costing you more money. So when you start looking at what am I consuming and then what's the distribution model, a lot of times that's where you can eliminate a ton of costs.
Love it. So, as just hearing this, like I know, and other people's, watching and listening to this as well, might maybe feel like, man, this almost sounds too good to be true. But like, especially when it comes to the quality of these prescription drugs. So, Carl, I mean, do these structures around pricing impact the quality of the prescriptions at all? And if so, how so?
Not at all. I mean, it's all FDA approved. It's the same medication. Okay. It's the same ingredients, the same medication. The only thing you're not paying for is the brand name. That's it. It's not a different medication. It's not a different drug. It's not a different formula. It's not any of that. A generic medication is a direct image of what you were taking as a brand.
I'm like, can I get your phone number after this?
Well, I think we laugh because, I'm the same way. I'm like, wait, I actually just learned that too. I don't know. I always thought like the brand name is better. Unless it's Kirkland.
No, not at all.
Like Kirkland Golf Clubs or something. I don't know.
Generic
sodas.
Not at all. Carl, so can you explain how marketing and direct-to-consumer advertising, how those affect drug prices?
All that marketing, Spence, all that marketing you're doing, like all those ads you see on television every time you turn on your news channel that are all talking about your Skyrizi, you know what it costs to run those that's millions and billions. I mean, the amount of money that goes into to spend is phenomenal. And that's what you're paying for. You don't see me on television.
You could.
I mean,
you could, Carl. You look great.
I could, but I can't. I don't want to have to charge you another $20 a month.
So, Carl, just shifting gears just a little bit to the affordable side now. So, no hype generics counter the brand name marketing machine while still delivering proven treatments. How does that work exactly?
Once a brand runs out of time, if you will, whatever their patent time is, whether it's 7 years or 10 years, then it opens up the door for other companies to go in and manufacture that. And that's where your generic medications come from. But our pharmacists It shocks me constantly at how often people come in asking for a brand drug that our pharmacists can replace with a generic. So we want to help people with that kind of advocacy and that kind of advice and guiding them in the right way to help them save money and get the health care that they need.
That's definitely a noble mission. We have a few more questions to go. Are there any types of drugs or conditions that are targeted specifically or impacted more than others? You know, like we've seen with GLP-1s and weight management drugs in recent years.
Yeah, so your weight management drugs, a lot of your antidepressants, a lot of anti-anxiety. What was shocking is it wasn't the older demographic; it was the younger demographic that were utilizing all these medications, and a lot of them were your ADD type stuff, your albuterols, your Vyvanse, antidepressants, things like that. So that was shocking to me. It was really your 20 to 40, not your 40 to 60, and so that was an interesting wake up call as well.
Yeah, I know. Speaking for myself, as I'm approaching middle age, some say I'm already there. But yeah, no, it has been remarkable in recent years seeing the numbers of people my age and younger that are involved with those sorts of medications that you mentioned. So moving on now. So how do prescription savings programs specifically support the most common and chronic and acute conditions like diabetes, mental health, infections, women's and men's health as well?
So we want to cover a much broader range and provide people with what they need. And you can't do that with 50 medications, I think that's a big part of it, is making sure you've got the bandwidth and you're dealing with all of these key chronic issues that people need help with. You want to have something in there that you're able to help everybody.
Now, Carl, you mentioned the wide variety of different prescriptions and drugs, ailments that people face. What are some alternatives or to traditional pharmacy benefit systems that people can explore that could maybe lower their prescription drug costs?
A great tool is AI. Now, if you've got a medication that you take and it's expensive and you need help, trying to find that. I mean, AI. I use AI to do research, right? And so I'm sharing this with you because it may point you somewhere you would have never thought of. When I hear people that like, oh, I'd really love to use AI for that. That's one of the things. Any kind of research, it can comb through so much data so fast, save you a ton of time.
It is a remarkable tool, and having AI and a program like some that we've mentioned here. I mean, it sounds like a real game changer. We've covered a lot here. It's been unbelievable, but now it's time to put your knowledge to the test. It's time for Hello Goodbye, where I'm going to give you a series of statements. And you tell us whether you agree or disagree. Hello means you agree. Goodbye, you don't. And of course, explain your answers so that our listeners can learn a bit more. So here we go with Hello Goodbye. Our first Hello Goodbye statement. Higher prescription costs always means better quality. Hello or goodbye.
Goodbye.
I had a feeling that was going to be it.
Yeah. Well, we kind of talked about that. I mean, it's like I said, the generics are FDA approved. They're tested. They run through the same testing, the same facilities. They have to meet the same treatment requirements. It's the same ingredients. There is no difference other than the price.
On to the next one now. Not every new drug is a breakthrough. Hello or goodbye.
Hello. Yeah, a lot of the drugs that you see out there are modified a version of this. You think about it. Hey, if we add a little bit more of this, it's going to have a better effect, or it's going to have a better cure, whatever that is. So a lot of times, it's just like a trial run with anything, right? So that's what's happening. It's just like our special forces. They go in, they do an engagement, they do a debrief, and they're figuring out what do we do wrong, and we're going to modify this, we're going to modify that. It's the same thing with drugs. So it could be a modified version, and a lot of times it is.
Gotcha. Oh, well, yeah, more you know. That makes sense, when you put it that way. I hadn't thought of it like that. So, alrighty, on to the next one. Hello or goodbye. Generics are often just as effective as brand name drugs.
Hello. Yeah, they are as effective. They are the same drug.
It is pretty straightforward, just like that. And the next one here. Insurance covers everything.
Goodbye. I mean,
I think every American knows that one.
well, it's me walking into the pharmacy and get whacked with a $407 deductible. I mean, that goes to show you what I think of insurance. I'm seeing they're squeezing the pharmaceutical benefits because typically pharmacy, if you're running a self-funded plan, let's say, your pharmacy costs are going to be 35% of that plan. Your spend is 35% of that plan. So now what they're doing is they're cutting back the pharmacy benefits.
So, all right, on to the next one, Carl. Hello or goodbye. Drug prices are set by manufacturers alone.
Goodbye. Yeah, there's a lot of things that determine the pricing, and your manufacturer sets the price. They're setting the price that they're selling it to me for. Okay, all of these steps that it goes through to get to you is all adding something to your pricing. So that's when it starts to creep up. The manufacturer can't control what happens after it leaves their house. There's no way until you get into this thing like we did and really start to tear apart the layers to even have an understanding of what is the cost that is built in these different, steps of the way. It's incredible. And that was one of the things that we were just determined to tear down, and we did.
The most expensive treatment isn't always necessary. Hello or goodbye.
Hello. I'll just say my internist will lean more towards a natural alternative than he will towards writing me a prescription, like Eliquis. I've got 3 open hearts. I had a dual valve replacement in my 3rd open heart. So I should be on Eliquis. I'm not. I take a baby aspirin and I take nanokinase, which is a root from Japan that acts as a blood thinner. And so I take nanokinase and an aspirin.
Never even heard of that before. Nanokinase, you said. Yeah.
Yes. It's Japanese root, and it's a blood thinner.
Moving forward now, the cost of direct-to-consumer advertising, such as TV ads and so on, are passed down to patients. Hello or goodbye?
Hello. Yeah, it is, and it's like I mentioned earlier when you see all these ads that come on the television. I mean, that's your that medication is going to be through the roof. I can guarantee you. But I was talking to a buddy of mine the other day, and he was putting in some eye drops. I said, "What kind of eye drops you use?" And he says, "Mibo." He says, $2,000 a month. Holy cow! What?
Good
Hey,
Lord.
Vizine's about $1.99, But that's the kind. But you see Mibo on television all the time. Well, for $2,000, you can have some eye drops.
Wow.
Yeah.
Just thinking about the kind of car you could get for $2,000 a month. But anyway.
Exactly.
Yeah. Holy cow. All right, Carl. Last one for hello, goodbye. Patients have no power to reduce costs. Hello or goodbye?
Goodbye. I'd have to give that one. You do have the power to reduce costs. You do have the opportunity to go out there and look for better resources. And like I said, use AI. I mean, AI can help you tremendously and do the research. But yeah, we're not by any means helpless. And look at your international markets. Look at what you can get overseas. We're so blessed now that we've got the internet. We've got worldwide shipping. We've got a lot of resources that we didn't have 20 years ago or 25 years ago that we can really we need to. I believe that we all need to become CEOs of our own health. We truly do. If you're not looking out for yourself and you're not doing what's best for you and researching what you should be taking and not taking. 30 years ago, when we went to see a doctor, they talked to us about everything, all our ailments. Now you're going to see a specialist for this, a specialist for that. And what happens is these doctors don't communicate and these hospitals don't communicate. So you get a prescription from this doc and then you get a prescription from that doc. Well, these prescriptions always they're not friendly, right? I believe that a lot of it can be mitigated if people just watched their medications and not taking medications that contradict or counteract with each other. That's a big issue in the medical arena that's got to be dealt with.
Amazing. Yeah. It's this, Carl, again, I can't thank you enough for joining us here today. I mean, this has been so educational. Clearly, folks, you heard it here first from a true expert. If we learned anything today, as you said, to be the CEO of your own health, you don't have to stay trapped in broken, expensive healthcare system. Affordable, high quality, hassle-free prescription access is out there. It does exist. So, Carl, again, thank you so much for joining us today. And thank you, the listeners, for tuning in. I'm Prescott Rossi for Tim, for Brittany, signing off with Carl Stecker, founder and CEO of FreeRx. And this has been the HelloNation podcast, where good news travels faster. We'll see you next time.
Thank you, gentlemen. Bye-bye.
Thanks for watching HelloNation.